I'm your host, Marsha Florence with Just Ask Podcast Live. Thank you, ladies and gentlemen, for tuning in on this very hot day in Michigan. Now, let me tell you this. Even if you're outside of Michigan and you have the chance to watch the show, I am very, very grateful to have you join us because some of the information that you hear, ladies and gentlemen, on the show pertains to us across the state lines. It doesn't mean it's just Michigan. It could be any state. And then when you hear a question or an answer to something, you may want to contact your representatives to ask them to check into that information for you. So don't think that everything that we do here at Just Ask is just Detroit based or Wayne County or Oakland County or Michigan based. No, some of the same information goes into your state as well. Chicago, Atlanta, LA, New York, and it's just a changing of the name. Okay, but the services are primarily the same. So today we have a returning gentleman that comes and joins us on a regular, and I appreciate this guy because why? Every time I see Rodney Ross of the Ross Group, he always has some very resourceful information to tell us about what's going on, with your insurances. Now, a lot of you not paying attention, but we can ready to go through a crisis in a minute that you ain't gonna never regret. I mean, you're gonna regret it, but I'm saying you're like you should have did something a little earlier. So we're going to have Rodney Ross come on to us today, come and join us today to tell us something about Medicare. What do you know about Medicare, or do you know? So without further ado, I want to have Rodney Ross join us. Hey, Rodney Ross.
Good afternoon, Marsha. How are you today?
I'm good. How are you?
Awesome. The Lord woke me up. My eyes popped open. I'm still breathing. Awesome.
Okay. Okay. Well, amen. Amen. Well, Rodney, I was trying to, and I said try because I was just so glad to know that you're going to take over where I left off and explain to our viewers some things or give us some insight on things that's going on with the Medicare. Now, with all this all these cuts and tariffs and all this stuff going on, maybe society is not really thinking in terms what's going to happen down the line, or maybe people are not sure how to address this. But I wanted you to join us today to fill us in on some things about Medicare, because a lot of people will be turning 65 in a minute. Okay. And what do they do? A lot of people think when you turn 65, they're the only ones that's supposed to apply for Medicare. So isn't there some things called special condition or whatever? Can you chime right in and tell us some things about Medicare?
Absolutely. So first of all, Marsha, thank you so much for allowing me to be, a guest on the show again today. I appreciate it.
Thank you.
Um, so I guess I would first of all say to everyone, when it comes to Medicare, when it comes to Social Security, you're hearing so much on the news and all this information. What I would say to you are two things. Thing number one, take a step back and breathe. Everything changes. Change is the one dynamic in this world that just doesn't stop happening. So things are changing, but it will be all right. Um, Medicare, as you mentioned, Marcia, there are 11,000 people that turn 65 years old every day of the year. 11,000 people turning 65. Now, people turn 65, they kind of fall into two or three buckets. One bucket is a person turning 65 that has a job, they're working a job, that job provides health insurance. So they don't need to have the full blown Medicare Part A and Part B because their employer has their health coverage provided. For the persons and so those persons, they can sign up for Part A and just keep it moving until they know they're going to leave their job and no longer have health coverage. That is when they need to add Part B. And they should do that about 90 days before they leave their job to be sure it's in effect on time.
Well, Rodney,
For the
before you go further, so what if a person really doesn't know? I mean, will they get a notification you're now 65, or will Social Security say something to them? Will there be some type of notation that they can say, "Oh yeah, I did turn 65 in July, and then I retired," 6 months later?
Here's what should happen. Operative word is should. Everyone should get a letter from the Social Security Administration stating that you are becoming eligible upon age 65 to enroll into Medicare. And it should give some instructions in terms of you can enroll online, you can call the Social Security Administration, or you can go into the Social Security Administration office. So everyone should about 96 months to 90 days in advance. However, I talk to many people, Marcia, who don't get a thing.
Mm-hmm.
Rodney,
Mm-hmm.
got that letter. I never got that book. So, for whatever the reason might be, everybody does not hear about it. Now, here's what I would say is the trigger. If you're a person and you watch, it's very hard to have the television or the radio on and not hear commercials from these companies about Medicare. So if you know that you are turning 65, that could kind of be a trigger to a person like, oh yeah, Medicare, I'm about to turn 65. What you need to give our office a call so that we can help guide you because we not only help people enroll into plans, we provide guidance to people that are about to turn 65. We tell you how to enroll, how we will walk you through the process and what needs to be done afterwards, the whole total steps. So give us a call. You can reach us. Can I get the phone number? Do you mind?
Go ahead.
586-393-7677. Give our team a call. So if you don't know what to do, and most people don't the
Okay.
first time around, just call us. No cost consultation. We'll walk you through it, guide you through it, hold your hand through the
Now,
whole process.
is there anything, or is there such thing as exceptions?
Absolutely. So exception meaning persons in terms of Medicare and the
Mm-hmm.
age 65.
Mm-hmm.
Yes. So Medicare was designed by the President Roosevelt for people that were turning 65. However, there are people that are under 65 that also qualify for Medicare. For the most part, those are persons that have challenges. They may be blind, they may be deaf. There are some medical conditions, as a matter of fact, that will qualify a person under 65 for Medicare.
Mm-hmm.
Autism is one example. Um, Lou Gehrig's, Lou Gehrig's disease, which is
Mm-hmm.
also called ALS. That's an example. And perhaps the one that most people are most familiar with is ESRD, or kidney failure, end-stage renal disease. If in fact you have end-stage renal disease, you can qualify no matter what age you are for Medicare Part A and Medicare Part B. Now,
Yeah.
one of the steps is you have to reach out to the Social Security Administration and file for disability. So
Mm-hmm.
that is what starts the process. And you're filing for disability based upon having kidney failure, or you perhaps have had a transplant, a kidney transplant. Either of those two things qualifies you for Medicare under the ESRD.
Wow,
The
that's deep, Rodney. I mean to stop you on the road there, but it's like, you never think about what the exceptions are, and like you said, Lou Gehrig's disease, or renal failure to a point where dialysis is just not doing it by itself.
Correct.
Those are some of the exceptions.
Yep.
End
And
stage. Hmm.
for a person, so if a person has, it's, let's say, for example, a person has a serious accident and they're no longer able to work, and they file a claim with the Social Security Administration for disability. Social Security will hear your case. They'll probably deny it because that's their process. You file for disability, they say no, they make you refile it again. If a person gets approved for Social Security disability, at the end of 24 consecutive months of receiving checks for disability from Social Security,
Hmm.
that person, no matter what their age is, they become eligible for Medicare Part A and Part B. So that is the basic or the primary entry point for many people under 65. They have some kind of injury that
Hmm.
stops them being able to work their job, and they apply for a Social Security disability. They are approved 24 consecutive. When they get to the 25th month of that disability, their Medicare Part A and Part B is automatically set up for them.
You know, Rodney, and I thank you for clarifying that for us because I'm sure there are some viewers that are not really aware of that, and they just like, well, when I get a certain age, they're gonna give it to me this and that. I mean, you know, some things come through the mail, and some things come through people's email, and then some things are just word of mouth. But here at Just Ask, we want to make sure that you have an opportunity to hear it, you know, and jump on as soon as you can because you're not going to get a call, ladies and gentlemen, from Social Security Administration saying, you know, you're turning 65, you need to come see us. They don't do that. DHS does that, you know, Department of Human Services. So if you're listening or watching, be mindful that whoever's in your family or near neighbors or whatever that's turning 65, you guys need to take note to this to understand when you should and how you should apply for Medicare. Now, right now, I wanted to move on from that part because I want to ask you, why do they say Medicare doesn't pay for prescription coverage? Is that true?
That is a true statement.
Okay.
Kinda. Here's the deal. There are two parts to Medicare options. There's what's called original Medicare, which is Medicare Part A and Part B that the government provides. The government only provides Part A and Part B, which only covers hospital and doctor. It does not include prescription drug coverage. However, the Medicare Advantage plans, which are also called Part C plans, that are sold by private insurance companies,
Mm.
those plans, they do cover prescription drugs. So for seniors that need prescription drug coverage and they're Medicare eligible, they have to have Part D as in David. And they either will get Part D by buying it separately
Mhm.
if they have original Medicare, or if they enroll in a Medicare Advantage plan with a private insurance company. That's these companies that have all these commercials on TV. Those are
Okay.
Medicare Advantage plans. Medicare Advantage and Part C mean the exact same thing. Tomato, tomato. Two words mean the same thing. Medicare
Okay.
Advantage and Part C mean the exact same thing. It's a Medicare health plan sold by a private insurance company.
So what are the tiers? Because I know they got like tier one, tier two. What are all the tiers?
So, in terms of prescription drug coverage, every company, first of all, establishes their own formulary. That's a big word that simply means list, drug list.
Mm-hmm.
Every Medicare company, they have a drug list. It's a list of drugs that they will pay for when their members need to get them. Drugs are categorized by being either a generic drug, a brand name drug, a specialty drug. And the things are called tier levels. They're described as tiers, and TIER, and tiers are they're numbers that go from 1 to 5. The lower the number, the lower your out-of-pocket cost when you need to get that medication. Generic medications are the least expensive medications. So when you have a generic medication, it's probably a tier one medication,
Mm-hmm.
and it's probably going to be a zero copay, maybe $2 copay. When you get to a tier two, that's a generic, but it's a generic brand, and it's going to be a little bit more expensive. Tier three gets to be pricey. Tier four and tier five, those are your high level specialty drugs, and they are very pricey. But
Okay.
tier
Okay.
levels, that is what tells you how much you are going to be obligated to pay toward those prescriptions. So when you hear tiers spoken about, the lower the number, the less money out of your pocket for copays to get those
The
medications.
lower the number. Okay.
Right, the
Okay.
lower the number.
You
And
heard
the
that,
low,
ladies and gentlemen. The lower the number. Some people are like, well, I hope it's one or zero, but but that means that,
and
like you said, now if it's a low number, it could be a generic brand. And then some people
well,
say
it's
they
going to
don't.
be.
I'm
Yes.
sorry.
So tier ones are generics.
Okay.
Generic medications are the tier ones.
Okay. You know, you're gonna have
And
somebody gonna say, I can't take generic.
so,
But
so let's speak to that. Not everybody can take generic. Generic medications, they have the same active ingredient that the brand name original has, but it cannot be a complete carbon copy.
Mm-hmm.
So manufacturer has to use some different products, different colorings, different additives. And this is where a generic medication can be problematic to somebody because the additive that is put in to the medication that can sometimes work against a person. The active
Okay.
ingredient is the same. So in terms of that, the medications are similar. They're just not identical as the brand name.
Okay. So I got a good question here. What's the difference between Medicare Advantage and Medicare Part C?
I
I
don't
know
know.
so you got Medicare Part C, and then you got Medicare Advantage. So why are we using all these different added titles when we all thinking that we just got Medicare, but we don't?
Well, marketing. That's the straight up answer. Marketing.
Okay.
Um, Part C. So I'll give another answer. The original Medicare, Part A, Part B. Medicare Advantage plans came along, so people began to call them or being marketed as Part C. Now, Part C is supposed to be a combination of A and B, Medicare Advantage plans. When the carriers start looking at how to market it, they say, hey, let's name it Medicare because it's Medicare plan, but Medicare Advantage because it gives you advantages over
Right.
original Medicare.
Mm-hmm.
So, that's how those two monikers, kind of got connected to the plans. Medicare Advantage is intended to cause us to believe or recognize you're getting more with a Medicare Advantage plan than with original Medicare. And that's an accurate, true statement. It also
Okay.
is true, you got Part A, you got Part B. What comes after B? C comes after B.
Mm-hmm.
So, yeah,
Well, people
but
get
they
a
may,
little. You getting. You can confuse a person when they think they got full coverage because they say, "Okay, I got Medicare," so they think that they got hospitalization, office visits, prescription coverage, medical
mental hearing
supply coverage.
vision.
Yeah, they just think they got everything, and then when you go somewhere and you find out you don't have one of these components, you don't even know who to call, when to call, and where to call. So that's why we're doing a show like this, Rodney, to make sure that people at least know when they get ready to uh, apply for their Medicare coverage, they know what it is that they need to have, and they can ask by letter or name or whatever is going to help them
Yeah.
make sure that they got the right components.
So allow me to use this analogy. You can when you go to a restaurant, you can just buy everything on the menu a la carte. Give me this, give me that, give me this, give me that. And you're just piecing together your meal. Or you can get what the restaurant has labeled as the entree. And the entree includes your meat, your vegetable, your salad, and your bread,
Mm-hmm.
all in one package at one price.
Mm-hmm.
That is the difference between original Medicare and Medicare Advantage. Medicare Advantage plans cover your whole entire body all in one plan with one cost. Hospital, doctor, prescription drugs, dental, hearing, vision are all covered in Medicare Advantage plans at one cost. Medicare Advantage plans are always sold by private insurance companies, not the government. The government, their
Mm.
product, original Medicare for the government, it's your a la carte. They give you Part A and Part B, but if you want prescription drugs, you got to add that on. If you want dental, vision, hearing, you got to add that on. So you have your a la carte original Medicare, and that gets to be pricey because you're adding different components versus Medicare Advantage plans sold by private insurance companies that package the health plan to include hospital, doctor, prescription drugs, dental, hearing, vision, all in one bag.
Wow. Wow. Okay. So now, I know it's almost that time of the year, what we call open enrollment. So, will
Getting
will
there.
You know it's getting close now. I mean, and ladies and gentlemen, you know it's like open enrollment is that time where the agents and brokers, and you can let me know if this is correct, Rodney, can call you and say, "Hey, do you want to sign up for this year?" And then come January is the time when they cannot call you, but you can call out and talk to your agent or broker and say, "Hey, I think I got the wrong package here. I want to switch over to something else." Did I say that right, Rodney?
Marsha, you didn't take an awesome notes. Oh my
Okay,
God.
okay,
You need to go
because
to business with us.
look, I was
Okay,
talking to
great. Yeah.
I was talking to my insurance the other day, and I was just floored. And I told them I have never changed insurances, but after this conversation I had with a young lady, I told her I said, I'm gonna have to do some reevaluation, and I'm gonna be nice and not call their name out. But I can tell you this: I wondered, and I heard this. I think when you a conversation you and I had about a nutritionist, that you can also have a nutritionist or nutritional plan, something
Yes.
like that, within your package. So I called
Yes.
mines and asked about it, and Rodney, the lady told me I had a $300 for life nutritional allowance. Now she said
Mhm.
life, ladies and gentlemen. Did you hear me? I said life. I thought
Life.
she, I
Right.
thought she meant this year. She said life. So
Life.
$300, and I only get $300 towards a plan, a nutritional plan, or to see a dietitian. I was just floored. I told him, I said, now everybody else getting away, fruit baskets,
Mhm.
transportation, gift cards, and you mean to tell me y'all talking about $300 for life? She had to laugh because I made it funny, but I was serious.
Right.
Okay, so,
So,
I,
so here are a couple realities. Um, we as people should not fall in love with
gimmicks.
doctors, and we should not fall in love with insurance plans. Here's what I mean by that. The insurance carriers, they exist to make a profit. That's why they exist. They they provide plans and services. We every year should evaluate how well did my plan work last year? Did it work well for me? And if it didn't, meaning um, bills didn't get paid, meaning that they didn't allow you to have certain services because it didn't include it, or they just had a $300 lifetime benefit, which rankled you. You really should look at and evaluate other companies, other plans. Now, our
Mm-hmm.
team, we write business in Michigan for 10 different Medicare companies. So we can provide you consultation and comparison across different carriers. And we work with people, we ask, what is it that you really need in terms of a benefit?
Correct.
And we target directing people to carriers and plans that offer specifically what they say they are most interested in.
Mm-hmm.
If you're not talking to a broker, if you're not working with our team, you're just really not most likely aware of everything that is available, and you can be missing out on some benefits that you could have.
That's true. That's true. Now, Ronnie, I only got a few more minutes, but I wanted to ask about what is this thing called hospital indemnity, the indemnity plan. I mean, I'm a little confused about it because I know you touched on it before, but can you do it again?
Sure. So when you hear the word hospital indemnity plan, let me tell you what it is not. That is not an insurance policy. That's what it's not. Here's what it is. It is a policy that you buy from a company that is designed to specifically help you pay for your out-of-pocket cost. For example, Medicare Advantage plans, all of them include inpatient services. You can get admitted to the hospital and your carrier is going to pay the bill. However, the carrier requires you to pay a part of that bill. So with most of the inpatient benefits, you have to pay, let's say for the first 6 days, you have a daily copay. Let's say that that daily copay is $300. If you are admitted to the hospital, and if you're in the hospital for 6 days, you owe $300 for each day. 6 times 3, 18, $1,800. If you're there on day 7 and beyond, you don't owe any more copay. But for those first 6 days, you're responsible for copays. This example, $1,800.
Wow.
If you have a hospital indemnity plan, here's what you do. You send a claim to your hospital indemnity company, and they are going to send a check to you with your name on it for $1,800 that you use to pay that hospital bill. So you don't have to write a check for
Mm-hmm.
your own. You don't have to use a credit card. You don't need to borrow money. The hospital indemnity plan, they reimburse you. They pay you directly. You then pay the
Okay.
hospital.
Well,
You
I'm
can
glad you said that because I was a little worried there, but you clarified it. You clarified it, made it
and
sound more easier.
here's the most important thing, most significant thing about the hospital indemnity plans. Most of the monthly premiums that I write for people when they are in the age range of 65 to 67, their premium tends to be in the $29 to $33 range a month.
Okay.
That's not,
Okay.
that's not exceptionally expensive. And
Break it down.
I'm always cautious about, saying what is not a lot of money because, I can't speak to anyone else's finances. But if you look at, you got a plan that requires $300 out your pocket for the first 6 days. If you are paying $30 a month in premium for a hospital indemnity plan, that is $360 for the whole year. That
Well,
$360 is going to get your $1,800 bill
well,
covered.
Rodney, you got to hold that thought, and I'm gonna thank you for joining me because you was on the road, and I know our audience is saying more, Marsha, more. So, Rodney, will you come back and join me again?
Yes,
Okay, all right.
soon I
Well,
hope.
hold that thought for
Yes.
me. We'll be right back. Hold on.
All
Well,
right.
ladies and gentlemen, if you need to reach out to Mr. Rodney Ross, there's his information right there on the screen, phone number, email, all that good stuff. And he always does an excellent job when he comes. So definitely you want to make sure that you reach out to Rodney Ross if you have some more questions. And don't forget, you know what's coming. The 5th annual Health and Fun Fair at the Samaritan Center this year, ladies and gentlemen, Samaritan Wellness Center on Connors, 5555 Connors. So don't forget about that on October 2nd. And you'll see Rodney there and a whole host of other wonderful people. All right. Well, of course, I'm your host, Marsha Florence. And what do I always say? If you got a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. I'm your host. See you next time.